Hello, I'm Robert, fact-checking and science blogging as a volunteer, and I'm here to help you if you're scared of various stories. So this is about COVID-19, and this is to show what I was talking about in one of my earlier videos about how even in the United States they're very localized, and large areas of the United States have it under control, or almost under control. So in this map, all the green areas, so if you go down to the county level, it's much less overwhelming than if you looked at the state level, because it's a few states that have it increasing. But as you can see, even in the United States, one of the worst outbreaks in the world, then you can see that large areas of it have no cases, or very few cases, and they're under control, and others are almost under control. You can look a little bit further, same also for Alaska up there. Give it a minute too. And then we go down to Hawaii, which is an island. So if you click on these maps, then it'll bring up a figure saying, there we go. I have to scroll a bit. Just a minute. There we go. So that's there you can see the Hawaii figure, and it's only, this peak was 5 cases a day for the average 7-day rolling average. I think that is. It's down to very few. So Hawaii is an example that shows you can get it under control, and then but then we also have many examples in New York State has it well under control, and so do New Jersey, and there's generally the Northeast is, although not completely under control, it's decreasing or steady from a peak which was a long time back, and it's mainly in the South and the West. The Midwest is kind of patchy, a mix of the two, and an awful lot of the Midwest is under control. And then that leaves the South and the West as the main ones. It's another map that shows the number of new cases in the last 10 days. And again the same thing, that most of the map is green, meaning there were hardly any or none. So the dark green ones here have had no cases for the last 2 weeks. So you can see large areas of the United States have had no cases for 2 weeks. Let's see if I can go for one of them. No, do you see? No cases for 2 weeks. And this makes it much more addressable. And the reason we had to have a countrywide lockdown is because we didn't have that information before. At the start of the lockdown, the United States had done not nearly enough tests, so they had no idea where it was. So that they locked down the entire country as a very blunt instrument, because and they should have used that opportunity to immediately ramp up on the testing, ramp up on the tracing. They should have done that right away from the beginning, not left it to the end. Found it in society, isolated it, found the main outbreaks, and then kept those under lockdown, and they could have released it everywhere else. There's no need for the entire country to be under lockdown, because they should have just done the testing, found the cases, isolated them, and found the regions with high numbers, and all the rest of it. There's no reason for this to ever be under lockdown if they'd been prepared to do that, and if they'd ramped up the testing quickly enough. Now the point in that is that now that so many states are coming out of lockdown, then once they're under lockdown, you've got to be very, very cautious before releasing it, because they can go up so easily. So, but once you've released, then if you've gone too quickly, then you have to go back to lockdown again. Then they don't need to lock down the entire state. For instance, here they would just knock down Wasatch, or however you pronounce that. And so because most of it is green or steady. So in any states, so you just need to lock down. If you do need to lock down, you just need to lock down the ones that are that are increasing, or that and that have had you don't need to lock down any of these counties that have had no cases for 2 weeks. So that's that. Right, yes. So yes, I was going to go to this one now, and so we can see, sadly, more and more in this. I think that it's a bit misleading. I think they should put New York in the it's decreasing category, because you just look at the last little bit, and it's steady for the last little bit, and it's not really going down. It's not really going up either, and surely New York is going to control its outbreak. But it's the same thing. If only New York had done it, if it had done its testing, tracing, and isolating right at the beginning back here, then it could have cut it off somewhere like that probably, and then they would have had just a few areas would have needed to be kept under lockdown, and the rest could have relaxed. But they, for some reason, and it's not just the United States, it's all the way around the world. In some countries ramp up very quickly, like Vietnam, like Taiwan, like Singapore, like the Faroe Islands for some reason, but others, they just do the lockdown and then they sit around doing nothing for weeks and months of lockdown, 2 months of lockdown in case of the United Kingdom, telling everyone to stay at home but not doing testing, tracing and isolating. And it's been very bizarre, because I've been watching this from the beginning, and I've seen the success of the countries that do test, trace, isolate, and I've listened to the WHO saying with every press briefing that this is what we have to do. And I've been living in the United Kingdom, where the United Kingdom just seems to be very blinkered and doesn't pay any attention to what's happening in other countries. So I've been living in this country where they're just not doing this very obvious measure. They've only just started doing it recently, after 2 months. So that basically is the problem. So now what else do I want to talk about? Yes, and then you also have to have clear messaging for the public. So the basic thing is that you have to do the test, trace, isolate and active surveillance. And many countries have shown you can do that, and that's for the government to do. Then the government has to explain to the general public, and they obviously haven't explained, so I'm not blaming the people here. So I want to make that very clear. It's not really the problem of the people. See, very close, no masks, no physical distancing. That's far, far too close. And this is Arizona, and after release of lockdown, and already knowing that the cases were increasing, and they went out on this tubing on the lake, loads of them, and not practicing, no masks and no physical distancing. Now, I don't say that's the problem of the public. That's the problem of the governors and the authorities not explaining to it clearly enough what the risks are that they are running by doing that. To explain that, she would probably start worrying if you explain to her that her granny and her parents are at risk because of what she's doing. And if you explain that probably 1 or 2 of the 1,000 there is going to die if they all got COVID-19, probably only a few percent would get it if one of them has it. But if all of them got it, then 1 or 2 out of 1,000 would die. And quite a few, up into percentages, so 10 dozen of them would end up on ventilators. So when you start thinking like that, and it's not being nice on a ventilator, you lose 6, maybe 4 weeks, 6 weeks of your life. Someone says, oh, we've now got to put you on the ventilator, and then the last, I'll leave it running, see what they're like. But and the last few and then you wake up several weeks later and you've lost 6 weeks of your life, when every breath had to be done artificially with people using a machine to help you breathe, and without that machine you'd have died. And then you're freezing, and you're short of breath. You're not easy to talk very loudly, and then you start. Eventually you get off the oxygen, and then you get home. It's not something they've got to explain this to these people, and I don't think that they would have done that if they had clear public messaging from the government and from the authorities. so they understand exactly what they are risking, not just for themselves, also for the elderly people. So just a reminder, but you all probably should know by now, but just in case you don't, that you have to do physical distancing. So that's 1 meter away, close to 1 meter. Those were far too close, the ones I pointed you out. 1 meter, at least reach out your hand. If you can touch the other person, then you're too close. And some, the further away the better, but that's what the WHO regards as being safe from empirical evidence. And then you've also got to do the washing your hands thoroughly, all the bits of it, between your fingers, your fingernails, your palms, your back, your thumbs, and develop a routine which Dr. Treadwell has shown one way of doing it, which makes sure that you wash all of that in 20 seconds. And then not touching your
Choose a bedtime for their device, with a little help from Google.
Cough into your elbow. They're now saying use cloth masks if you can, but that's only if you're very close to people. And just that. So you got to you can use masks are only needed if you have to be within 1 meter of someone, and you're also talking or potentially coughing, sneezing, etc., so as to the droplets can go to them. If you just walk past someone less than 1 meter away, you're not going to get it that way, as I've explained quite a few times. And the masks only, they don't protect you from infection because it can get to your eyes. Also, if you touch something infected and touch the front of your mask, that's another way for it to get to you. Touch your eyes, nose or mouth. And with the mask, the main question with WHO was whether the public would use it correctly. It obviously does work for health workers, but with general publics, they say simple cloth mask to stop as a source control makes a big difference. But if you do it properly, you should not touch the front of the mask in any way at any point during the day. Just put it on around your ears, adjust it using the loops around your ears. Don't adjust it by touching the front of it. And then at the end of the day, take it off around your ears, still never touch the front of it. And then if it's a cloth mask of the type you wash it in hot soapy water, and any virus in it will be gone. And then put it on next day again. Don't touch the front at any point. And then if you do that, then that will help with the few percent of cases. So but you also should not be going out if you think you've got COVID-19. You should self-isolate and get tested. So there's only the pre-symptomatic cases or very early symptomatic where you don't really realise that it could be COVID-19. And in that situation, then wearing the mask could make a slight difference if you can't do the physical distancing and the WHO in their study about it, and they cited a study from Singapore which made 6.4% was the amount of pre-symptomatic infection. So it's probably a very small number, like 6 or 7%, that can be prevented, and that can be prevented can be helped by wearing masks, not necessarily totally prevented. Depends how careful you are. So it can make a difference, but masks by themselves there's too much focus on it. If it leads you to forget to think that you can be as close as you like, then the messaging has gone wrong. So you've got to do the physical distancing as well. And you've got to thoroughly wash your hands, you've got to use the mask properly, not touch the front of the mask at any point. Then that's the way to make it most effective of all. Maybe it's a reminder, it shows other people as well that you are taking precautions, so it might make it easier to say to them, I want to stand back a meter. But if they say to you, but you've got a mask, just explain to them that the mask isn't enough by itself. So that's it. So we can stop this, absolutely we can stop this. And the Arizona, they have been doing some things. They've closed the pubs, I believe, in Arizona, increased the distances in restaurants, but the general public have to comply. They keep on doing that sort of thing, just wandering around and in large numbers, then they have to go back into lockdown. That's the reason they do a lockdown. It's to enforce compliance. If the general public did the physical distancing properly, they wouldn't need to do any lockdown. So we have three measures that can stop COVID-19. We have the lockdown, which is forcing everyone to be distant from everyone else, whether or not they have COVID-19. Whether or not they have symptoms, whether or not they're coughing or anything. They just forced everyone apart. And even that is not totally effective, because you still have healthcare workers, you still have the doctors and things, you still have essential services going on. And then if those aren't doing the proper distancing, then you've still got routes for it to spread. And then you've got the physical distancing, which by itself would be enough. If we all did it very rigorously, then it's not like flu, it's not like SARS. If one person gets onto a plane with SARS, 20 can get off with SARS. If one person goes onto a plane with COVID-19, one person comes off. So it's very different from SARS. And so this makes it very controllable if we just follow the basic public health measures. So if we could get everyone around the entire world to follow those basic public health measures, you don't have to stop it completely. At the moment, on average, if it's not controlled in any way, each person infects 2.5 others. If you can get it down so nearly everyone doesn't infect, and that's usually one person, one super spreader, and 9 people who are not super spreading. And super spreader infects maybe 20 people. So you need to stop the super spreading especially. And if you're doing physical distancing, you won't have super spreading. You can't super spread with physical distancing. And so so that would reduce, and certainly just test, trace, isolate by itself, if it's done rigorously and with a small amount of lockdown. New Zealand reduced the 2.5 to 0.5. And that means that if you start off with 100 cases with COVID-19, then and then those would infect 50 others, those would then infect 12, and then 6 and so on, and you end up with about 200 cases total, and it's over, and then it goes extinct. It can't flourish for long if you get the reproduction number down to less than 1, significantly less than 1. If you get it to a half, it's soon over, within a few weeks, or less, as New Zealand showed. So one way is by test, trace, isolate. So the people go around, they're still not doing proper physical distancing, but once someone gets COVID-19, then you get them to isolate. Then you ask them, who were all your contacts? And they say, oh, I was talking to Joe Bloggs yesterday, and at close range, we weren't shouting across the fence. He was he was within 1 meter of me, and for 15 minutes or so. So they go around they go around telling you basically all the situations in which they weren't doing proper physical distancing. And then you trace up all those contacts, you tell them to isolate. So if you're not doing physical distancing, then you can get it with test, trace, isolate. You find the people who've got it, you then find their contacts that they haven't been isolating away, from keeping enough distance from, and then you get them to isolate, and in that way you get down to 2.5 instead of 2.5 average transmissions per person. And then the other way to do it is with a lockdown, and if the public are very compliant, as they were in the UK. So I was in the UK, and right at the beginning when they started the lockdown, then they did not, nobody predicted that the lockdown was going to control COVID-19. In the first few weeks, they just said this is going to flatten the curve. That was the UK's only aim, was to stop it rising quite so quickly in order to reduce the strain on intensive care units. But luckily, the UK public were very compliant, kept at home very strictly, far more compliant, I think, than the modelers expected. The modelers also were modelling it based on flu assumptions, which they thought it was being like SARS or flu. It didn't seem to be. There were some things in their modelling I think wasn't quite right as well. And the end result was that it actually was controlled just by lockdown. So I think the UK was the first country to show that lockdown by itself can actually control COVID-19. So that was new. China didn't show that, because China, when it did its lockdown, also had intensive test, trace and isolate right from the get-go. And that's why Wuhan, it went down so quickly, because the test, trace, isolate. So the UK was the first country to stop it, to reduce the numbers just by using a lockdown. So we have two methods. We have test, trace, isolate with the sloppy public. We have lockdown with the sloppy public, where the public, although they don't comply with physical distancing, out of lockdown. If they're in it, then they keep to the lockdown restrictions carefully, because it's much clearer and simpler instructions. Instead of saying stay a metre away when you're talking, they just say stay at home and don't go anywhere except when you go to the shop. When you're at the shop, then you have all these things, only 3 people allowed in the shop and so on, all these very strict measures. In our local shop here, it's quite a small shop, only 3 are allowed in it at a time. And then if you're the 4th person, you wait for one of those 3 to come out. So those measures, they work, and those alone. But then when you ease the lockdown, those only slightly reduce it, very, very slowly. Our government did reduce it, but much more slowly than New Zealand did. And then as we eased from lockdown, then you need something to take its place. Well, the test, trace, isolate should be put in place well before that. We should have done it from the beginning, because when you're under lockdown, then it's much easier to do the test, trace, isolate. Much easier, because people have far fewer contacts. So this is going to happen in the United States when they go back to targeted lockdowns. I'm sure they will. I can't see them not doing some targeted lockdowns of the worst zip areas. Then, if they do test, trace, isolate in a lockdown, then they'll be back in the situation that they should have been, a couple of months ago, where it'll be much easier to trace the contacts because everyone's under lockdown. So that is something else to bear in mind. It's an encouraging thing. If they do a lockdown, they combine it with proper test, trace, isolate, they can stop. So if they did a lockdown here, say, in Papi County, which currently has 46 cases, up from 6.1, that's not so many. We think in the count of 46 cases a day, it's quite a lot. It was seen huge at the beginning of the outbreak, but, when that would have been a big outbreak in a country, it would have been seen as. Now we see that as being quite a small figure. So if they did a lockdown, then those 46 cases per day would have much fewer contacts, maybe 5 or 10, maybe even less. Some people would have none or just their own family. Then it makes the tracing far, far easier. And then that means you can isolate nearly all their contacts. You can probably get it down to less than a half. And then the public are automatically compliant, because as long as they keep to the lockdown measures, which are also much easier to enforce. But so that's two ways. There's the test, trace, isolate, and there's the lockdown, and then finally there's the public just doing the physical distancing. And again, if we all complied with the physical distancing and did that properly, except for the very, very few situations where you absolutely can't avoid being closer and you have to talk. It's okay being in transport and not talking, but if you absolutely have to talk to someone, then your cloth mask will help, but it's better not to, if you can, if there's a risk of COVID-19. So if you're within 1 meter, or say step back. So we have 3 different ways to control it now. I don't know of any country that has control that. Certainly, the UK shows you can control it entirely with lockdown, but very slowly. And various countries, like the Faroe Islands, for instance, test, trace, isolate, but various other places have found. Oh, there's a fourth way that I haven't mentioned. Uganda did this, and I think there's another place. One of the is that if you don't even need, if you just test everyone in your entire population, and it would be feasible for the United States to do this too, if they hugely ramped up on testing. There are lots and lots of laboratories that can do this testing, and if they were to leverage those non-medical laboratories, your veterinary laboratories and such like, and if they were to authorize them to do the testing, the PCR testing, then the United States could feasibly test everyone, symptomatic or asymptomatic. If you're in the United States, you get tested. Someone costed that, and it's several $billion a year, but it's nothing compared with the cost of the lockdown. And someone else costed it in the United Kingdom, who could also test absolutely everyone in the United Kingdom using a similar method of using the labs that already exist, that already have the PCR equipment, that use it for fish and animals, and the veterinary labs, and university research labs, and all sorts of labs that are non-medical, and they're using it to a certain extent, but there are far more of these. The PCR machines everywhere in an advanced society like the United Kingdom or United States, an advanced economy. Every university, labs everywhere, wherever you have veterinary labs, you get these PCR machines, and they can be adapted, and it's often much lower cost also because their suppliers don't have the high cost of the medical suppliers, and yet they can be at a level which is useful. And talk about the reliability, so you have to work on that as well. But people have actually done that. That's what they did in the Faroe Isles. So if you could test, so that's the fourth method, test absolutely everyone, and that is a very fast way of reducing it. You don't need to do any contact tracing if you use this method. Test everyone once a week or more often, 2 or 3 times a week, and if anyone has COVID-19, you isolate them, and you don't need to do any contact tracing, because as soon as anyone gets COVID-19, you find them with the tests. So that is a very fast way of reducing it. You can do the contact tracing as well on top of it, and that might find a few people a day or two early, but this is another method that has been used. It's mainly used in hospitals. So if you test everyone in a hospital, then it's a small localized situation, and then you can isolate them, and then you test again, and that way you can find all the cases in a hospital. But it has also been used in Uganda as well, as a way in a small Italian town, and it was used somewhere else, but I forget now where. I did a blog post about it. So this is very fast. It's faster than the test, trace, isolate. So we actually have 4 different ways to eliminate COVID-19 without a vaccine. When we get a vaccine, that will be our 5th way to isolate, to eliminate COVID-19. And any combinations we can combine, of course you could use the test everyone. It is used sometimes in a care home, for instance, in care homes and in hospitals. Then sometimes they test everyone. So that 4th method is also used sometimes, if you've got enough testing capacity to do it, then it's a good thing to do. And finally, and there's also pool testing, which is a way to test 5 people at once, which could also be combined, or say 5 people, 4 people, or something like that. And there's a possibility of reducing sensitivity, but if you are careful about it, and just do a bit of pooling, and even doubling, you're testing them in pairs, and that halves the amount of testing you have to do. And then you just get a bit from each sample, and you test the 2 together, and with 1 test, and then you've got the 2 remaining halves of each sample, and if it tests are positive, then you have to test both of those. But most test negative, so that halves the number of samples you need to test. And then, if you, depending on the prevalence, if you've got hardly any COVID-19, then you can pool in 10s, 16, 20, 32 or whatever, and most of those will turn out to be negative. The problem is that if you have very large pools of say 30, 64 or something, then you can get to the point, and even small ones like 8, it reduces the sensitivity and it's more of a risk that you don't detect it if the swabs were already borderline when you first took them. So obviously it's a very clear signal, you're still going to detect it, but if you got them early on with the swab and it's quite borderline, then the more you pull it, then the more cases you're going to miss. But it's a very good way to quickly survey an entire population to try and find out where it is, if you haven't. So they could have done that early on in lockdown before they knew where it was in the United States. China did that in Wuhan, pooling 5 at a time to find its outbreak in Wuhan, and then localize down to find that outbreak. Okay, I've talked a little bit longer than expected. How am I doing? Half an hour. Oh well. Anyway, I'll upload this and hopefully it helps some of you. And yes, the main message is we can control COVID-19. We know how to do it. As I said, we've got 4 different ways of doing it. And when we have a vaccine, we'll have a 5th way. So some combination of all of those and combining them means you can control it faster. So you could do all of those. You could do a lockdown combined with test, trace, isolate, combined with whenever people have to do essential, have to go to the shops, they have to do anything essential services, they do the physical distancing, and then finally you also do testing everyone. You can usually ramp it up, and then with the tracing be a little extra on top of that, and then that's something we could do. It would cost much less than a lockdown. Once you've got a vaccine, you then vaccinate as well on top of all of that, and then it would be gone very quickly. And so, when you're looking at the economic costs of a lockdown, then doing all of those would probably cost much less than the economic cost of a lockdown. Anyway, and just a reminder of our Facebook group, Doomsday Debunked, and you can where we fact check, with the fact checkers there as well, fact check the stories that scare you, and to join either as a fact checker or if you're scared. And if you are fact checking, please don't just guess. If you don't know, then don't tell someone something as a guess. Please do the proper fact checking and try and find someone else who knows, and then you can reassure people and in other ways, just say and think things that you do know and things that you can help them with. So maybe see some of you there.